Hello, I'm Katie, I'm the Medela educator and I'm also a midwife and lactation consultant. Today I just want to talk about feeding cues. This is actually a really important subject because when I've run breastfeeding classes, I always ask parents to be, how do you know when your baby is hungry? And most parents will say when they cry. And actually, crying is a late sign of hunger. It means we've missed those earlier, much more polite feeding cues. So it's really good idea to keep an eye on your baby, particularly in the early days when you're learning as well, on what your baby's doing. Because even when your baby is just starting to stir awake, they're probably getting very ready for feeding. And if you bring them up to the breast at this point, they'll probably, even with their eyes closed, look and find the breast and actually latch on for a feed. But sometimes you might not be that early and you might wait until your baby is doing more significant feeding cues. And this might be that the baby puts their hands in their mouth and they start to search for their hands and they're trying to eat their hands. Also, you might see that the baby maybe knocks their face, or you touch the baby's face and the baby will root and look for the breast. You'll also see that baby might be poking their tongue out or even making little noises and starting to open their mouth and almost look for you and call for you. These are the early feeding cues. Feeding your baby when they're giving you these feeding cues is much less stressful than a crying, screaming baby. So keep a close eye on your baby, keep your baby close to you, and you'll find that breastfeeding is much easier to get started. For more tips like these, join us at our Medela breastfeeding blog and you can see the details below.